There's so many questions that surround coronavirus and the vaccines. Primarily, who's eligible? How do you sign up to get one? A lot of us have been answering questions. You've been contacting us.
Yeah, Dr. Allison Arwady, the Commissioner of Public Health for Chicago, joins us now to talk more about this system. You are the head woman in charge here when it comes to this. Where do we get the vaccines? How do we do it? I tried to get my mom one, and I called. They said, well, you have to be invited, and you're invited over the internet. Well, a lot of older, elderly people are not using the internet and not using,
Online means, yeah.
So what do they do?
Yeah, so in fact, the way most older people are getting signed up is when their provider calls them. So there doesn't even need to be internet involved. We've got hundreds of providers that are enrolled across Chicago, and we've asked them to start with their oldest patients with the most underlying conditions, reach out to them and help them make an appointment so that they're not having to negotiate all of that internet stuff. You can go to chai.gov/COVIDvax to see where there are sites, where there are pharmacies, for example, that have vaccine for the general public. We're also doing some vaccinating through employers, bringing vaccine to homeless shelters and other settings. But the bottom line is there's just not enough vaccine for everybody right now. We're getting 34,000 doses a week, and there are more than 360,000 Chicagoans over 65, another 350,000 essential workers. So we do ask patients, but know that providers are reaching out to a lot of our highest risk Chicagoans.
Well, so we really just have a small percentage of what is actually needed. So we need more. Hopefully when Johnson & Johnson comes online with theirs, and I understand the governor had some good news when it comes to communications with the Biden administration with more rollouts. Can you address that?
Yeah, we did hear from the Biden administration that there's a small increase coming for the next 3 weeks, about 15–16% increase, which helps, but it's still not enough. But the Biden administration has very much committed to putting additional resources into making more doses of the Moderna and Pfizer and buying those. And then obviously we're all watching closely for both the Johnson & Johnson and the AstraZeneca vaccines. So I'm hopeful that, a month from now, 6 weeks from now, we'll be in a place where there is a lot more vaccine, but especially for the next month. Again, patience really is, unfortunately, the word of the day. Please rest assured, we are getting a lot of vaccine out. We're pushing 99.9% of the vaccine we receive here in Chicago out. It's going into arms, and we're going to get it into your arm just as soon as we can.
Let's talk about one of the biggest problems right now looming here in Chicago, getting teachers, getting the Chicago Public Schools back to in-person learning. Teachers are not happy right now. The union may be striking as early as tomorrow. Why can't the teachers be vaccinated? Why aren't they priority? Why are they not essential workers?
So they are essential workers. Teachers are in the 1B group. They're eligible for vaccine, just as the other 750,000 Chicagoans are eligible for vaccine. And there is a plan that CPS has released to also make sure they can get vaccinated through their employer, just like we're doing for all the other frontline essential workers. So there is a plan, but the problem is there's about 140,000 educators here in Chicago, just in that K through 12 and pre-K group. And we just don't have enough vaccine. If we were to stop and say, we're not going to do anybody over 65, we're not going to do first responders, we're not going to do any of these other settings, it would still take us 5–6 weeks just to get through educators. So there is a plan, and they are in that plan. There are already people being vaccinated, but it is going to take a number of months, just to be perfectly honest.
So why not continue remote learning until then?
So the bottom line is that we have seen over and over again, even before there was a vaccine available, that when you have good mitigation strategies in place, and we've seen that here in Chicago too, the Archdiocese, we've had a lot of private and parochial, we've had daycares open for months. Schools are not a source of spread for COVID. They don't seed community outbreaks. And in fact, when we compared both students and staff who were in person in the Archdiocese schools here over the fall, they had lower rates of COVID than their counterparts who were not in school. So I certainly hear people's concern, but there's been a lot of work to make sure that the appropriate mitigation strategies are in place. And I do remain very confident in the plans that CPS has put forward, and vaccine will layer onto that over the next few months, just as it is in all other settings.
So it sounds like you feel that CPS, with that $100 million investment when it comes to filtration systems, systems and the air handling system and the separation, the pod learning, that all of that has combined to make a safe learning environment. What is it, in your opinion, going to take to sort of communicate that and make everybody understand, what your thinking is in terms of kids and staff safety?
Yeah, so obviously my thinking on this is always to look at the data. And the good news is that we have been very focused on child settings here since the very beginning of the outbreak, really looking whenever children are diagnosed, whenever there are settings that bring children together, looking at the health of kids and adults in those settings. And honestly, we know a lot more about COVID than we did a year ago. And one of the good news stories has been around this country and around the world, schools have been open at places at settings where outbreaks much worse than where Chicago is. And again, we've not seen them be significant sources of spread. And that doesn't mean you don't need to have all of those mitigation things in place, but I'm very confident that they are. I'm a pediatrician. I also see adult patients, and safety is always my first concern. I wouldn't be supportive of having school in-person session if I thought that it was going to be putting teachers or students at significant risk. So I know there's been a lot of conversation about this, but I would just encourage people. The CDC just yesterday put out another letter and series of studies just reinforcing what we do have at just dozens of studies that have shown this over and over again. And it is surprising. There are other diseases. If this were measles, if this were flu, we might not be able to do it. But this is COVID. And from everything we've learned, you put the right things in place, these settings can be open. So I'm hopeful. I know those conversations are still continuing. My goal, of course, is to make Chicago as safe as it can be for everybody from a COVID perspective. And that means pushing vaccine to the parts of the city and the settings that are most driving our COVID outbreaks, even while we make sure that we prioritize teachers as well.
Will we see more supplies going to the Black and brown communities?
Yes, definitely. We've unfortunately seen some lower rates of uptake in some of those communities when we were focused on healthcare workers. And the mayor announced, as part of our Protect Chicago Plus plan, that we are pushing some additional outreach, lowering barriers, making sure there's some additional vaccine available, again, largely through providers at this point, with more to come in those neighborhoods. So we got to get past this as a city. That means not having one part of the city over-vaccinated and another extremely under-vaccinated.
All right. Dr. Allison Arwady, Commissioner of Public Health for Chicago. Be safe, be well. Thanks so much for joining us today. I know you're busy. Thanks a lot.
Thank you.
All right, take care.